Been growing concern tonight after a devastating Ebola outbreak in Central Africa. Now that outbreak overseas is having an effect right here in the DMV. Dulles International Airport, the focal point of the Trump administration's national response to that outbreak. The disease has spread across 3 nations, the Democratic Republic of Congo, Uganda, and South Sudan. Starting today, the Department of Homeland Security is now requiring that passengers who recently have been in those 3 countries must first arrive at Dulles for a health screening before going elsewhere. Our Christian Flores is live at the airport tonight at Dulles with the very latest. Christian?
Yeah, if you've been to any of those 3 countries over the past 21 days, you'll first be required to get a health screening here at Dulles Airport instead of grabbing your luggage and heading out of the airport or even getting on another flight and continuing on with your travels. Now, we spoke with travelers who told us that this actually does give them some peace of mind, but one health expert says a lot more should have been done before this outbreak.
I hope it helps by eliminating how many places they're being left off, and they can concentrate here on stopping everything.
I think it's easier contained and they could put the resources in one location. I think they should limit the amount of flights coming into Dulles so the disease doesn't come to America.
The CDC is observing travelers from 3 African countries. Dr. Kirsten Leik specializes in diseases like Ebola and says it's important to catch symptoms early.
In Ebola, we call it the dry phase, where they just feel like they're getting the flu and they have a fever. And then it moves into a much more serious phase called the wet phase. And that's, what we typically think about of hemorrhage, diarrhea, vomiting, and people can get ill very, very quickly. And of course, there's a very high mortality.
Those with a fever or other symptoms will be further evaluated and possibly taken to a hospital isolation unit. Currently, there are no suspected cases in the U.S., but Dr. Leik argues precautions should have been taken earlier.
What we need to have done is a month ago be in country and capturing it. So now we're kind of faced with this, Band-Aid measure. It's extremely low likelihood that, at this point, people exposed to Ebola are coming into the U.S. Just to reassure the public, we do have quarantine areas in the DMV, so it's, we are prepared for this.
Now, despite this major change to flight routes, an airport spokesperson says they don't anticipate any major disruptions to travelers. Reporting live at Dulles International Airport, Christian Flores, 7 News.